Ever wondered how anxiety medications really work inside our brains? They're incredibly common, but the science behind them is fascinating. In this explainer, we're going to break down two major approaches to treatment, see how they're different, and uncover the critical trade-offs involved.
First things first, it's so important to understand what we're actually talking about. An anxiety disorder isn't just, feeling stressed before a big presentation. Clinically, it's when that anxiety gets so big, so out of proportion, that it actually starts to interfere with your daily life. Grasping that is really the key to seeing why these medications can be so important for people.
So, where do we start? Well, let's begin with the classic heavy hitters of anxiety treatment, a class of drugs you've probably heard of called benzodiazepines. For decades, these have been the go-to solution when you need powerful, fast relief.
Their main claim to fame? It's all about speed. When someone is in a state of acute distress, benzodiazepines are known for their ability to provide relief and to provide it quickly. This makes them incredibly effective for short-term management of severe anxiety.
You've probably heard some of these names before, right? Alprazolam, clonazepam, diazepam, they're some of the most well-known members of this drug family. They all work in a pretty similar way, and their primary goal is exactly the same: to calm down the central nervous system, and to do it fast.
But how do they do that? How do they achieve that rapid calm? Well, the answer lies deep down at the chemical level, in a process we can call the GABA story.
This is the big question, isn't it? How can a pill create a state of calm in a brain that's just firing on all cylinders? The secret, it turns out, isn't about adding something new, but about amplifying something that's already there.
So, let me introduce you to GABA. This is the brain's main inhibitory neurotransmitter, and honestly, the easiest way to think about it is as the brain's brake pedal. When your brain gets too excited, too overstimulated, GABA is what steps in to slow things down. It's your body's own natural calming agent.
So here's how that natural brake pedal works. When a neuron gets overexcited, it releases GABA. GABA then travels over and docks onto a receptor on the next neuron, kind of like a key in a lock. When it docks, it opens a tiny gate, a channel. This lets in chloride ions, which effectively cools down that next neuron, making it way less likely to fire. It's the brain's own elegant, built-in system for telling itself to just slow down.
So where do benzodiazepines fit into this? Well, they don't push the brake pedal themselves. Instead, they act like a power booster for the brakes. They bind to a completely different spot on that GABA receptor, and in doing so, they make the whole thing much more sensitive to GABA. So, with a benzo on board, every time GABA comes along and docks, that channel opens up way more frequently. You get a flood of these calming ions. The brain's natural brakes are suddenly supercharged. Now, a superpowered brake pedal sounds like a perfect solution, right? But this is where the story gets a lot more complicated. That incredible power and that incredible speed, well, they come with a pretty significant trade-off.
The pros are clear. You get fast anxiety relief, it can have sedative effects, it relaxes your muscles. But the cons are severe. The high potential for both psychological and physical dependence is probably the biggest risk, and that can lead to cognitive impairment and just debilitating withdrawal symptoms.
And that withdrawal is no joke. Stopping these drugs suddenly can trigger a whole cascade of symptoms, often including a rebound of the very anxiety the person was trying to treat in the first place. This high risk of dependence is precisely why benzodiazepines are typically recommended for short-term use only.
So those significant risks pushed researchers to find a completely different strategy, and that led to a newer class of medication with a fundamentally different approach: Buspirone. If benzos are the fast-acting heavy hitters, you can think of Buspirone as more of a modern modulator. It's much slower to take effect, and, this is key, it's not sedating. That's because it works on a completely different system in the brain, serotonin. It basically fine-tunes serotonin activity rather than just slamming on the brain's brakes. And when you look at them side by side, the contrast is just stark. Instead of enhancing GABA, the brain's brakes, Buspirone works on serotonin to regulate mood over time. This gives it a very different profile. The onset is slow. We're talking weeks, not days, which means it's not the right tool for a panic attack. But for managing chronic, generalized anxiety, it can be a great option. And the trade-off for that slow start is pretty clear: no sedation and, crucially, minimal risk of dependence. It really represents a shift from emergency intervention to long-term management.
Okay, so let's zoom out for a second and just summarize the key takeaways from all of this.
What we've seen are really two distinct philosophies for treating anxiety at the chemical level. The first is a fast, powerful intervention that supercharges the brain's GABA system, but it comes with those serious dependence risks.
The second is a slow, steady modulation of the serotonin system with far fewer risks. At the end of the day, it all boils down to a fundamental trade-off: speed versus long-term safety.
And that leaves us with a final, thought-provoking question. When we're treating anxiety, is the goal to powerfully amplify the brain's emergency brakes, or is it to patiently retune the entire engine for a smoother ride over the long haul? The answer to that question continues to shape the future of mental health care.